there's been some really interesting data looking at, like, there's in the Philippines, and Indonesia. Where else? I think New Orleans as well. They've looked at patients that have died and their vitamin D levels, and basically, like in the Philippines, people that for like every standard deviation increase in vitamin D levels, serum vitamin D levels, the people had like an 8% or were 8 times less likely to have a severe form of COVID-19, and they were 20 times less likely to have critical form of COVID-19.
Whoa.
So that was the Philippines. In the Indonesia was a really interesting study where like they measured vitamin D, and this was measured in the patients. There's been some vitamin D studies also where they're like looking at, countries that have been affected the worst, and they all like have low vitamin D, and it's like, okay, well, anyways, that's a correlation. But so is this, but it's a little stronger data. In Indonesia, patients that died, almost 100%, it was like 98 point something percent of patients that died with COVID-19 were vitamin D deficient. 4% of patients that died from COVID-19 were vitamin D sufficient, only 4% were vitamin D sufficient. So basically they're all vitamin D deficient, all the ones that are dying.
Whoa.
Crazy, right? And like New Orleans had some crazy number.
What would be the mechanism that would cause that?
So I think all right, can we get into vitamin D?
Please do.
It's a big,
because of you, I take 5,000 IUs a day.
Awesome. Right now I'm taking 5,000 IUs a day. 70% of the U.S. population has insufficient vitamin D levels, which is considered less than, blood levels less than 30 nanograms per milliliter.
And this is something that your body